Mr. President, reserving the right to object. I heard a very similar speech last week when Senator Paul came to the floor to offer this exact same resolution, and I came to the floor to offer the exact same objection. And I guess we're going to be here next week and the week after having this same back and forth on the Senate floor. I don't know that this is the most important problem facing the country today. The question of whether a small number of Senate pages have a vaccine or not. I think Senator Paul's obsession with page vaccine policy is a little weird and not squared with the actual priorities of the American public. But I'll continue to come down here and object because it's important to know that there is no legal mandate that pages be vaccinated. It's a policy, not a mandate. Senator Paul is proposing a mandate through this resolution that under no circumstances can pages be required to have a vaccination as a condition of their employment here. I find Senator Paul's recitation of his body of evidence interesting. I don't dispute the fact that the vaccine today is much more efficacious on preventing serious illness and is not, like prior vaccines, effective at preventing transmission. But here's the two things to say about that. Senator Paul says over and over again that if you're a healthy kid, you have nothing to worry about, that no healthy kids are dying. Okay, that's broadly true. It is true that healthy children have very little risk of dying of COVID. But the assumption then is that every single page as part of this program has no pre-existing conditions, that every single page comes here with a clean bill of health. That is not true. There are pages here, just like our employees, who have pre-existing conditions. And we have a responsibility for the young people that work for us. We have a long history in this country of requiring vaccinations for young people. Senator Paul objects to that policy. But it is long accepted that young people, during their school-aged years, should have a set of vaccinations to keep them healthy. And if you have a pre-existing condition, even as a child, you have a potential of dying from COVID. Guess what? COVID is the 8th leading cause of death for young people today. That's not insignificant. And so it is perfectly consistent with the general policy we have in this country of requiring students to get vaccines to require the same of the page population, who, by the way, are students. The second thing to say about this resolution is this. Even if Senator Paul is correct, and I broadly would submit that he is, that this vaccine is really about preventing serious illness, not about preventing transmission, this resolution is permanent. This says that under no circumstances should a Senate page be required to have a vaccination. But what if a follow-on vaccine is more effective at preventing transmission? What if the next COVID variant is a more significant threat to children? This is a mandate. This is no matter what the scientific recommendations are, under no circumstances, no matter what the scientific recommendation is, can you require that a Senate page, as a condition of working in the Senate, have a vaccination. That's bad policy. I would rather have this question be up to the attending physician, to the adults who run the page program, than have mandates from the United States Senate about the health care policy of our pages. I think this is really bad policy. But I also think it's super dangerous. Because really, the question of whether a handful of pages in the Senate have a vaccine is not worthy of a half an hour of back and forth between two United States senators. What this ends up being is yet another wedge to try to drive apart the American public from a belief in science and vaccines. This is a long-standing effort by Senator Paul and others to question the efficacy of vaccines. It feeds into a broader narrative about the efficacy of science writ large, and that has devastating consequences for this country. Because as people lose faith in medical recommendations, as less people get vaccines because they come under the belief that the vaccine will do more harm than good, people die. And so by itself, this is bad policy, because this is part of a broad consensus in this country that students should get vaccinated for significant conditions, and this policy stands no matter what the future recommendations of medical professionals are. But I object to it just as strongly because of how it fits in to this broader, incredibly dangerous narrative to try to undermine people's faith in science and vaccines. And for that reason, Mr. President, I would object.